I think we can all agree on one universal frustration when we look in the mirror. It's seeing those dark, tired shadows under your eyes. They can be bluish, purplish, sometimes a deeper brown, and they just instantly make you look worn out. It doesn't matter how much sleep you actually got.
That's precisely why we needed to do this deep dive, because before you can even think about solutions, you have to understand the basic mechanics of it.
What's really going on there?
Yeah, exactly. I mean, dark circles are really just discoloration beneath the eye. And the reason they're so obvious comes down to pure biology.
The skin is different there.
It's the thinnest skin on your entire body. It's incredibly fragile, so any changes to the blood vessels right underneath or any little shift in pigmentation, it's just much, much more visible right there.
So, okay, it's not just a sign of being tired. It's actually a structural and a circulatory problem.
It can be.
And that leads right to our mission today. We've gone through the sources to build a framework for everyone listening. The key question is this. Are you dealing with discoloration, so pigment or blood pooling, or are you dealing with shadowing, which is more structural, like thin skin or hollowness?
And that distinction is everything. It's the key to figuring out what will actually work for you. A goal here is to break down all those root causes and then lay out a really specific, targeted, 8-pronged approach to getting some permanent reduction.
We'll be looking at everything from, quick fixes to more advanced procedures.
Exactly. From the stuff you can do this morning to clinical treatment so you know exactly which path to take for your type of circle.
Okay, let's unpack that. If the treatment really depends on the cause, we need to spend some time diagnosing the problem. What are the major factors driving this darkening?
We have to start with genetics. The source material is really clear that this is a primary major driver.
So you could be born with it.
You can. Some people are just genetically predisposed to having thinner under-eye skin. That means the blue veins are always a little more visible, or they're prone to what's called periorbital hyperpigmentation.
Riches.
Their body just produces extra melanin specifically in that area. So if you've had dark circles since you were a kid, there's a very good chance genetics is the main culprit.
So sometimes it truly is just the luck of the draw, and no amount of sleep is going to completely fix it.
Exactly right. Then the second major factor is, of course, aging.
Right.
As we get older, the structural integrity of our skin just decreases. We lose collagen, we lose elastin, the skin naturally thins out.
And that makes the blood vessels pop more.
It makes them more apparent, yeah. But it also causes fat and even bone loss around the eye socket, which leads to actual hollowness.
Ah, so that creates a physical shadow.
Precisely. The eye reads that shadow as darkness, even if the skin pigment itself hasn't changed at all.
That is a fascinating distinction. Actual color versus a shadow. Okay, let's talk about the circulatory category. That sounds like it falls squarely under discoloration.
It does. We're talking about blood circulation issues, specifically what happens when blood isn't cleared out of that area efficiently.
So it just pools there.
Kind of, yeah. When circulation is sluggish, blood can pool in those tiny capillaries under the eyes. And because that blood is deoxygenated, it looks like a deeper bluish or purplish color.
Okay.
And what's really interesting from the sources is that systemic issues like anemia or an iron shortage can make this way worse.
How so?
Well, you have poorer blood oxygenation to begin with and maybe a paler complexion overall, which just makes any of that underlying blue and purple vasculature stand out like a sore thumb.
I want to pause on that anemia detail.
Yeah.
That suggests a dark circle isn't always a skin-deep problem. It could be nutritional.
Absolutely.
So if you're getting your sleep, using the right creams, but nothing's changing, maybe a blood test is the next step, not a new serum.
That is 100% correct. You know, these systemic issues often need a holistic solution before any topical treatment is going to make a dent.
Okay, so beyond those structural and circulatory factors, we get into the lifestyle triggers. Sleep deprivation is the obvious one, but how does it actually make circles darker, not just puffier?
Lack of sleep triggers a stress response. Cortisol levels go up, and that dilates the blood vessels to increase blood flow. You couple that with fluid retention from lying down, and you get dark, puffy eyes.
And what about the less obvious triggers?
Dehydration is a big one. It just dulls your whole complexion and shrinks skin cells, so your skin is less plump. That emphasizes any underlying shadow.
And allergies. I know so many people who get those allergic shiners.
Allergies are a massive contributor. Your body releases histamines, which cause capillaries to dilate and leak, leading to puffiness and darkening. And then there's the mechanical part of it.
The rub.
The constant eye rubbing, it just exacerbates the irritation, dilates the vessels even more, and can lead to more pigmentation over time.
And connecting this back to overall health, the sources specifically call out smoking. The damage there sounds like it's coming from all angles.
Oh, it's a double whammy for both discoloration and shadowing. The chemicals in cigarettes restrict blood flow, which is terrible for circulation, and they fundamentally damage your existing collagen and elastin.
So it just speeds up the aging process.
It accelerates it, yeah. It impairs the skin's ability to heal, depletes oxygen, and speeds up thinning and drooping. That breakdown of structural support means veins become drastically more visible much earlier in life.
Okay, that makes the case for minimizing those habits pretty undeniable. So since the cause dictates the cure, let's get into the solutions. The source material outlines 8 key pathways.
Right, and we can break these down into immediate physical treatments, targeted topical ingredients, and then the essential preventative stuff.
Let's start with the immediate fixes for that morning emergency. First up, the cold compress. But if the problem is structural or pigment-based, isn't cold just a temporary mask?
That's a great question. And you're right, it doesn't fix hollowness or hyperpigmentation. Its value is purely for circles caused by circulatory pooling and temporary puffiness.
So how does it work?
It's pure vasoconstriction. You apply something cold, an ice pack, a chilled spoon, whatever, and it shrinks those dilated blood vessels. That reduces blood flow, it minimizes the fluid retention, and it just calms everything down.
How long does that relief last?
Usually for a few hours. It's perfect for a 10 to 15-minute application in the morning.
And related to that, we have topical caffeine. Is that just hype, or does it really work in a cream?
No, it's proven science. Topical caffeine is a highly effective vasoconstrictor. When you apply it, it gets absorbed and narrows those tiny blood vessels right under the surface.
So a similar effect to the cold compress.
A very similar effect. It reduces blood pooling, lowers fluid buildup, and gives you this temporary tightening and draining effect. It works best on those puffy, bluish-purple circles.
Okay, now for the really interesting part. The ingredients that aim to fix the problem long term. Let's start with vitamin C, the heavyweight champion of brightening.
Vitamin C is an all-star because it has this dual action. First, it's a potent antioxidant that actively works to suppress melanin formation.
So it targets the brown pigmented spots.
Directly. And second, and this is crucial for the structural issues, it's essential for collagen synthesis. So by promoting new collagen, vitamin C actually helps thicken the under-eye skin over time, making those blood vessels less noticeable.
It's working on the surface and the foundation.
Exactly.
That makes vitamin C sound essential for everyone. But then there's vitamin K. If C is building the foundation and reducing pigment, is K necessary for everyone or just for a specific type of circle?
Vitamin K is more niche, but it's incredibly powerful if you have a primary circulatory problem. It's essential for blood clotting and vascular health. It works by improving circulation and strengthening the capillaries. This helps prevent blood from pooling and leaking. So if your circles are that distinct bluish or purple tone, vitamin K is what you need.
So a simple rule might be, if you're brown, go for C. If you're blue, go for K.
That's a pretty good starting point, yeah.
And sometimes the solution is simpler. The sources stress just basic moisturizer. Why bother with simple hydration when we have these powerful actives?
Because dry, dehydrated skin is unhealthy skin. It's thinner, and it exacerbates every other problem. Moisturizers plumb up the surface skin cells, which immediately makes blood vessels less visible.
And long-term?
Long-term, ingredients like hyaluronic acid and glycerin restore the skin barrier, and they prevent water loss. It's just non-negotiable skin health maintenance.
So we have our targeted topicals.
Right.
Now for the non-negotiable preventative measures. The number 6 on the list is getting adequate sleep.
And this is about more than just feeling rested. This is about cellular repair. 7 to 8 hours of quality rest is when your body clears metabolic waste, improves circulation, lowers puffiness, and reduces the stress hormone cortisol.
Which, as you said, thins the skin.
Exactly.
And number 7, minimizing sun exposure. This feels like the simplest one.
It's the most critical preventative step against pigmentation, period. Consistent use of a broad-spectrum SPF and sunglasses is key because UV damage is the primary trigger for increased melanin.
So sunlight just makes those brown spots worse.
It actively makes them worse, and once that pigmentation sets in, it's extremely hard to get rid of.
And finally, number 8, treating allergies. This is about preventing that mechanical stress, right? The rubbing.
Exactly. Managing your allergy symptoms, maybe with an antihistamine, eliminates that inflammatory response. But crucially, it removes the physical urge to rub and scratch that sensitive skin. That prevents the trauma that leads to permanent darkening.
That's a really powerful integrated strategy. But sometimes, especially with genetic thinness or hollowness, you need professional help. Let's talk about the heavy hitters.
Right, this is when you move beyond over-the-counter. Topical retinol, or retinoids, are often the first recommendation because they are powerful collagen stimulators.
Do they thicken the skin?
They accelerate cell turnover and thicken the dermal layer, making circles less noticeable. But a major caution here, retinol has to be used very cautiously around the eyes because of potential irritation.
And for in-office procedures.
Yeah.
If the problem is shadowing, fillers seem like a direct fix.
They're the gold standard for that. Dermal fillers add volume to the hollow area, that tear trough. This immediately gets rid of the shadowing effect. The results are quick, dramatic, and can last for months.
And for stubborn pigmentation, what are the options there?
Laser therapy is often used. It targets and breaks down the pigment particles and also stimulates a bit of collagen. Or you have chemical peels, using things like glycolic acid, to exfoliate that top layer of dull, pigmented skin.
Just to circle back for the listener who's maybe rushing out the door right now, if they could only pick one thing for speed, what's the fastest fix?
The fastest fix is always about constricting vessels and draining fluid. So that's a combination of a very cold compress paired with a highly concentrated caffeine lotion. Those two things will give you instant relief from puffiness.
Excellent. Now let's zoom out and look at lifestyle. We touched on hydration and diet, but let's do a deeper dive into the health practices that really support long-term success.
You have to treat the body as a whole. First, hydration. Aiming for about 8 glasses of water a day keeps skin cells plump and helps your lymphatic system flush everything out.
And what about specific nutrients from food?
A diet rich in vitamin C, E, K, and iron is huge. And antioxidants, think dark leafy greens for vitamin K, citrus for vitamin C. These all support robust blood flow and capillary strength.
And on the flip side, what should we be avoiding to prevent that morning puffiness?
Definitely minimize salt and alcohol, especially before bed. Both cause fluid retention, and that fluid collects under the eyes overnight, which makes puffiness and shadowing way worse.
And finally, stress. We mentioned cortisol. What's the practical advice?
Chronic stress degrades collagen. It literally thins your skin. So managing stress through things like meditation, exercise, even just deep breathing, it helps lower that systemic inflammation and gives your skin a chance to repair itself.
Let's bring this all together with some concrete product examples to show how these ingredients are actually formulated.
Sure. You could have a high-concentration vitamin C cream. Its entire purpose is to reduce pigmentation by suppressing melanin while also promoting collagen to thicken the skin.
So that's for the brown discoloration and the thinning.
Correct. Then for the dullness and surface pigment, you might look at a glycolic acid chemical peel.
The exfoliator.
Right. It's an AHA that just removes that top layer of dull, damaged skin, allowing the brighter skin underneath to come through.
And for that simple, foundational hydration.
That would be an eye cream balm. These are often dense and soothing, with things like aloe vera, chamomile, shea butter. They reduce puffiness from dehydration and promote baseline collagen development. It's the essential first step for everything else.
So what does this all mean for the person listening? It sounds like we've given them the tools to be a detective for their own dark circles, not just a product buyer.
That is the core takeaway. Dark circles aren't one single thing. You have to diagnose the type first. Is it pigment brown, so you use C? Is it circulation blue or purple, so you use K and cold? Or is it shadowing hollowness, where you might need retinoids or fillers?
And then you combine that with the lifestyle changes.
You have to. You combine that targeted treatment with prioritizing sleep, staying hydrated, and consistent sun protection. No single cream works if you're ignoring the root cause.
That is the perfect summary. So here's a final thought for you to chew on. Since we've established that dark circles are caused by either discoloration, pigmentation, or blood pooling, or by shadowing thin skin or hollowness, which primary cause do you think applies to your situation? And based on that diagnosis, what single high-impact adjustment are you going to start with tonight? Are you going to focus on thickening the skin with collagen builders? Or are you just going to treat the surface appearance with some cold or caffeine? The choice is yours, and now you have the knowledge to make it count.